Hello, my name is Joshua Price, and I will be giving my bone oral exam today. I will be using my computer, I will be screen sharing, and I made a PowerPoint that has unlabeled pictures of the skeletal system. I will be pointing these bones out that I'm required to present by pointing them out with my pointer. Hopefully, you can see my mouse pointer right here. And everything you see, I see. I'm just completely screen sharing my computer. All right, let's get started. Let's start with the cranium. So the cranium right here, you'll see the parietal bone, the frontal bone right here. You can see part of the sphenoid bone, the temporal bone, occipital bone, the zygomatic bone, the maxilla bone, the mandibular bone. Mandible bone. You see the nasal bones. You can see maxilla again right here. And then this is the lacrimal bone. And then right back here, right behind the lacrimal, is the ethmoid bone. Ethmoid bone's right here. Over here, you can see the hyoid bone. Hyoid bone's right here. And then if we look closely, we can see the alveolar process. This is where the teeth fit in to the maxilla and mandible. And then part of the mandible, the ramus of the mandible, the mandibular condyle, it's right here. And you can see these small holes, the supraorbital foramen, the infraorbital foramen, and the mental foramen. If you look at this temporal bone, you'll see the styloid process of the temporal bone right here, the mastoid process of the temporal bone. And right here, right where it connects to the zygomatic, is called the zygomatic arc. So that is made up of the temporal process of the zygomatic bone and the zygomatic process of the temporal bone. You can also see a couple of sutures that connect the cranium together. Like right here is the coronal suture. You can see the squamous suture, the lambdoid suture. You can't see the sagittal suture, but it's like right up here. Connects the parietal plates together. And we'll move on to the next picture. It'll show the vomer bone and the inferior nasal concha. You'll see the inferior nasal concha right here, and close up underneath inferior view, you'll see the palatine bones. Palatine right here. And you see more of the sphenoid bone back here. See a little bit of the ethmoid. Ethmoid's kind of hard to see. All right. And that will be everything on the cranium, or the skull, facial bones. We'll move on to the vertebra. So this is the cervical vertebra. This is the thoracic vertebra. And this is the lumbar vertebra. The sacral vertebra and the most inferior part is the coccygeal vertebra. Coccygeal vertebra is right here. You'll see the back of the shoulder blade, the scapula bone. And then anterior, you'll see the clavicle bone. Clavicle bone's right here. You'll see the sternum right here that connects to the 12 ribs. The sternum is made up of the manubrium right here, the manubrium, then the sternal body, and then the xiphoid process. Xiphoid process is that little thing poking out at the bottom of the sternal body. So when we look closely at the ribs, there's the true ribs. So there's true ribs right here that are actually connected by cartilage to the sternum. And then you'll see down here at the bottom, the false ribs. These false ribs, they are called false ribs because they are connected to, or some of the false ribs are connected to the true ribs by cartilage. They do not directly connect to the sternum. And then at the very bottom, these last two ribs are called floating ribs because they are not connected by cartilage. And you can see that they don't connect to this costa cartilage right here. All right. You can see the humerus bone right here. Humerus bone connects to the scapula by the glenoid cavity. The glenoid cavity is right here. The head of the humerus right here. The lesser tubercle, the greater tubercle right here. And then down near the distal end, you will see the medial epicondyle of the humerus, the lateral epicondyle of the humerus. This is the trochlea of the humerus. The trochlea connects to the trochlear notch of the ulna. And that's important because that's how you can move your elbow right here. You can see the elbow. This is the ulna right here. The head of the ulna is more distal. The head of the ulna is more distal down here. And you can see a styloid process right here. This little tip is the styloid process of the ulna. And then this is the radius bone. The radius bone, you can see the head of the radius is more proximal than the head of the ulna. And the radius has a styloid process down here, another little point. And yep, that is it. We will move on to the next picture. So this next picture, you can see the hip bone. This hip bone is made up of the ilium, the pubic bone, and then this ischium bone right down here. But you can also see the iliac crest right here. There's a couple of joints like the pubic symphysis that connects them together, and also the sacroiliac joint right here that connects the ilium to the sacrum. And that these three right here, the ilium, pubic, and ischium is the pelvic girdle. You can also see a little bit of the femur bone right here with the head of the femur, neck of the femur. This is the greater trochanter right here, and the lesser trochanter. And we'll move over here. You can see a better picture of the femur bone down here. This is the patella bone. Where you feel where the knee is your patella. And you can also see farther down, this is the tibia. The larger lower leg bone is your tibia. And to the side right here, the smaller is the fibula. And right down here, you can also see like on the medial side, this is the medial malleolus. And this is also the lateral malleolus of the fibula. Okay, we will move on to the carpal bones. So the carpal bones, we'll start with the scaphoid bone. Scaphoid bone right here. This is the lunate bone right here, triquetral bone, and the pisiform bone. Pisiform bones right here. This is the trapezium bone, the trapezoid bone. This large bone is the capitate bone right here. And this bone right here is the hamate bone. And these bones right here are the metacarpal bones. Metacarpal bones are connected to the proximal phalanges. Proximal phalanges are connected to the intermediate phalanges. Intermediate phalanges are connected to the distal phalanges. The thumb, as you can see, does not have an intermediate phalange. It only has a distal and a proximal phalange. All right, let's move on to the ankle bones, the tarsal bones. So you can see closely right here that this is the talus bone. Talus bone right here, calcaneus bone right here, navicular bone right here, and this right here is the cuboid bone. And right here you can see the lateral cuneiform bone, intermediate cuneiform bone, and the medial cuneiform bone right here. Medial, intermediate, and lateral cuneiform bones. And then you'll see the metatarsal bones. metatarsal bones right here. You will see the proximal phalange right here, the intermediate phalanges, and also the distal phalanges. And again, with the big toe, it only has two phalanges, the distal and the proximal phalanges. All right, and that should be everything. I hope you enjoyed my presentation, and thank you very much for listening.